December 1st, 2018 marks the 30th anniversary of World AIDS Day, a day created to raise awareness about HIV and the resulting AIDS epidemic. Since the beginning of the epidemic, more than 70 million people have been infected with HIV and about 35 million have died. Today, around 37 million people worldwide live with HIV, of whom 22 million are on treatment. In Uganda, about 1.3 million people are living with HIV and AIDS. According to Dr. Joshua Musinguzi, the head of the AIDS control program at the Ministry of Health, this figure is steadily going down.
Our viral load suppression rate was approximately 60% in the last survey that we did, which is good news. That shows that our treatment programs are working, that quite a number of people are actually suppressing. But of course our target is to have this at 73%.
Studies conducted after the first detection of AIDS in Uganda showed that the prevalence then was as high as 18% in the 90s. This means that 18 people out of every 100 had AIDS. Fear, stigma and ignorance is what defined the HIV epidemic that raged through the world at the time, killing thousands of people who may have only had a few weeks or months from diagnosis to death, if they even managed to be diagnosed before they died. In 1991, the need for increasing awareness against AIDS was in high gear and the HIV movement was branded with the iconic red ribbon. Fighting HIV/AIDS is now a priority, and partnerships, coupled with support for developing countries all over the world, have been vital.
Ensuring that we promote primary prevention among women of reproductive age groups, to ensure that in the first place we do not have a big number of women that are in the reproductive age category that are HIV infected that may get pregnant and pass on the infection. We are also looking at, for example, things like early sexual debut, unprotected sex, as you know, multiple sexual partnerships. Now, those are also being addressed along the ABC approach.
However, even with all the efforts towards eliminating HIV/AIDS as a public health threat, the Ministry of Health and government are held back by a number of challenges, including complacency, especially amongst men.
We are concerned that men are not taking up services as well as women. For testing and for treatment, and also for viral load suppression, men are still lagging behind. We are seeing some gaps among adolescent girls and young women. We are seeing some gaps among men. And in the Presidential Fast Track Initiative, we are trying to pick out these subpopulations which are not yet there as far as the 1990s are concerned.
Dr. Musinguzi says this partly explains why more men die of HIV and AIDS than women, yet the infection rate is higher in females. In 2014, the 90-90-90 targets were launched to galvanize further action against HIV/AIDS. By 2020, the targets were that 90% of all people living with HIV will know their HIV status, 90% of all people diagnosed with HIV infection will receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy will achieve viral suppression. Walter Mwesije, NTV.